Hello, and welcome to the Healthcare Facilities Network. I'm your host, Peter Martin of the Healthcare Facilities Network and Goslin Martin Associates. As always, thank you for clicking on this video, which happens to be episode 2 of what we're calling a revenue-generating approach to emergency management with my guest, Scott Cormier. Scott is Vice President of Emergency Management, Environment Care, and Safety with Medxcel in Indianapolis, Indiana, headquartered in Indianapolis, Indiana. If you didn't see our first episode, Scott's got a pretty big footprint. Medxcel is in 21 states across the United States. So episode 2 picks up on the discussion we had in episode 1. So when I click over to Scott and I talking, Scott will be talking about information and what it was like getting the proper information out to folks during the early days of COVID. Because as you know, information was coming fast and furious. One of the reasons that I wanted to have Scott on to the network was because of the approach that Medxcel takes to emergency management. When I saw Scott give a presentation at the ASHI Annual, I just thought he had an interesting way of thinking, especially as it relates, emergency management and revenue generation, they probably don't often go into the same sentence. In fact, revenue generation and many things in facilities management probably don't go together these days, which is, again, why I want to have Scott on, because it was a very interesting perspective into the world of emergency management. We cover that quite a bit in episode 1. So if you didn't watch that, I would encourage you to do so, because it's a perspective that we don't often get. And again, that is the goal of the Healthcare Facilities Network, is just to tell the stories you can use in your facility, because there's many pressures on you today. And if you can increase some revenue, well, that's a good thing. So in episode 2, we talked quite a bit about an incident that impacted the Texas area in 2021. So we talk a lot about foul weather. We talk about planning for that, the approach to that. And we also have, Scott also has some interesting comments into dealing with your employees when they are dealing with a disaster at home. When a hurricane hits their area, they have a home they got to protect, they have a family they got to protect, but they also have a job. So we close this video, talking about that, and I think Scott's words are pretty insightful. We also talk a little bit about a weather service or a meteorological service that Medxcel uses. As you know, I do love the weather. I say it in there. I was not good at science. I was not good at math, and therefore my prospects to be a meteorologist, as well as my prospects to be a power forward at Marquette, were limited. So what do? We cover it as opposed to doing it. But whenever we can get a little meteorological discussion in that's relevant to healthcare facilities management, I always like to do it. So, as I said, thanks for watching episode 2. If you didn't see episode 1, I will link to it at the end. And with that, I'm going to transfer us over to the discussion where Scott will pick up talking about information in the age of COVID.
Well, I mean, imagine during COVID, all the information coming out from CDC, the World Health Organization, local news, national news, Facebook, social media.
Yeah.
And what do you do with it? And so we learned very early on, we need to control the information. And so we sent out a newsletter to all of our hospitals and clinicians and our staff every day, which said, here's what you heard in the news, here's what it means, and here's our direction. And so when you control that information, people are going to build trust in you.
Yeah.
Same with weather events. We subscribe to a private meteorological service that has a GPS coordinates of all of our hospitals. Now, if weather is one of the greatest vulnerabilities I have, why do I only invest in a TV to watch what the national news is saying?
Yeah.
And it makes a huge difference. So Hurricane Michael was a Category 5 hurricane that came into a community where we are. But we knew from our forecast, we were only going to see Category 1 storms. That means
Michael, the one a couple of years ago that was out in the Gulf as a 5, and then it weakened as it approached.
Panama City.
Yeah.
And we stayed open, and the other hospitals in the community closed, and we stayed open and we served our community. And we also supported the federal government with some of their search and rescue teams. Huge, huge deal. And so when I first came here and we started our weather program, I would get on calls. Hey, Scott, I just saw the national news and
Yeah.
meteorologist is coming to town, so it's going to be bad.
Right.
To say, okay, well, here's our meteorologists, and they're going to talk to you, and they do. They get on our phones and answer questions. And year two, it turned into, did you see the silly stuff they were saying on TV? Thank you for giving us the right info.
Yeah. Well, yeah, it's funny. I think, as I said when we were emailing back and forth, I love meteorology. I love weather. And, here where we're located in New England, it can be a little complex because you get the interaction between the ocean and the cold and what it does to storms and all. And I mean, I study this stuff. I'm not a meteorologist. So like, I tell my friends and they'll ask me for forecasts because the people on TV, listen, they've got the degree, they know what they're doing, but it's all hype. I mean, they're doing it for ratings. And so they can tell you X, but it's going to be Y. You can't, the level of trust, it just isn't like it should be because they're about ratings and getting eyeballs to it. So, like I said, my family will always ask, Pete, what's going to happen? Because they're saying this. What do you think? Not that I'm any better, but I live here and I'm not about hype.
Yeah. And I grew up in the New England area as well.
Where'd you grow up?
I was born in New York, lived in Connecticut. My dad grew up in Brockton. So every winter and every summer, we were either there or at the Cape. So I was shoveling driveways in Brockton during my winter break.
Sure. Brockton can, like during a nice nor'easter, they can really clean up with some good snow totals. Oh, I didn't realize that. So yeah, there's a nice diversity of weather here.
Yeah, there is. And the sea makes a big difference. And we have some Northeast coastal hospitals as well that we're always watching out for, the nor'easters that come up.
Yeah. Yeah.
And that's why it's so important to have that accurate information of what weather you're going to see.
How long, Scott, have you used the meteorological firm?
I started at my private company, so I've been using them since 2007.
Wow.
And they have more meteorologists than the National Weather Service. They do a lot of work with shipping and they do work around the world. And they're very accurate. Their models and their modeling is very accurate. And so we've really developed a trust in them.
That's nice. Last thing on weather, because we're not here to talk to weather. I do want to go to Dallas, but I think part of the issue is like people want, like especially in today's world, people want an answer. Like, is it going to snow and how much snow are we going to get? And when's it going to start? And as you know, it doesn't always work that way. It's a pretty complex environment up there, and people want answers, but weather does. Sometimes you don't know until you're 12, 24 hours out.
You're right. And I remember a hurricane that we had moved assets 72 hours before landfall into Florida. And then it shifted and it was going to hit Mississippi. And so we shifted our assets there. We ended up kept shifting our assets until all of our stuff was in Texas where it hit. And that's the hard decision for a healthcare leader. I don't want to evacuate. I want to wait till the last minute to do things. And we know that that's not prudent to do that. You have to make decisions and then be able to pivot from those decisions. And a great example is we had a hurricane in Texas in 2008. And we made a decision, one of our hospitals near the coast, we did a partial evacuation, which means we evacuate all of our ICU patients. We keep med surg there. And we evacuated our NICU, which had 42 babies in it. So the next morning I get a report and I'm saying, okay, what's our census? And they said, we have 47 babies in our NICU. I said, how can that be? We just emptied it.
Yeah.
Well, a hospital down the street that had a NICU evacuated at the last minute just before landfall. There was no place for them to go. So we took them into our hospital. And so we ended up temporarily hiring their NICU nurses to put them to work to help care for the patients. But, you have to look at emergency management as a community effort because what other hospitals are doing are affecting what I'm doing.
Yeah.
And that's why we spend a lot of time meeting and lecturing so that we're all on the same page so we don't get caught like we did in Texas.
What would it take for you to close the doors to a hospital? What type of an event?
And I've evacuated hospitals in the past. It has to be that we cannot sustain our operations. And it's too dangerous either from the infrastructure side of it, our building envelope, or from us getting supplies for them.
Okay.
And so we have in some hurricanes evacuated our hospitals. I almost evacuated a hospital due to heat. Temperatures were above 100 degrees. We lost our public power. Our HVAC system wasn't working, and there's really no way around that.
Yeah.
I think somebody suggested to me, go to Lowe's, get a bunch of box fans. Well, box fans aren't going to cool a hospital, right? We were able to overcome that. But
Okay.
those are really the decision processes we have. Either it's too dangerous to be in that facility, or we can't maintain the safety and care of our patients.
Mm. How do you, I want to get down. How do you though close off the noise? Like take that example, the one you just gave in with the heat and the humidity and the HVAC issue. I'm sure you have people communicating with you. Chirp, Scott, what are we doing? You must have all of these inputs coming, but yet you need to kind of remain steady and focused and, with the task at hand. How do you close that out and just make a decision?
Yeah, at the end of the day, you have a handful of information, and that's what you have to go on. We don't fly by the seat of our pants. All of our decisions are going to be based upon information that we can track back to it.
Yeah.
And sometimes that handful of information is a small handful, but always considering the best thing to do for your patients. And I think all hospitals do that, whether they make the right or wrong decision. What's the best for our patients?
Right.
We're just able to look at scraps of information and use that to help us make a decision.
Okay, let's jump to talking about what happened in the Dallas-Fort Worth area in 2021. But before I do that, you mentioned the risk document that was developed.
Yes.
Where can people find that if they wanted to?
It is on the ASPR, which is part of HHS website. But if you just use your search engine and type in RISC, risk assessment, it'll come up. And we just released the new tool with the federal government. And so every one of our hospitals, as well as our outpatient centers, use this, but you can do it for a community level as well. So in Texas, where I have 13 hospitals in Austin and a hospital in Waco, I can combine those to see what my risk is in the state of Texas. Cool. So it's a great, unique tool. Our people are actually putting together a training video for the federal government on how to use the tool successfully. But I encourage everybody to go out and look at that.
It sounds like it actually sounds like one of those documents that might just kind of suck you into using it and running all these different tests on it or queries on it.
It is. It's one of those programs that you can't put down. And that's a good thing because we want our safety and EM people in the tool and using it. And for some things, like it asks you questions about your IT infrastructure and your risk for cybersecurity events. Well, we use a standardized approach for cybersecurity across the country. And so we were able to answer those questions once and then share it through the platform for those answers, obviously localizing a few of those questions.
Right. This is Peter Martin. If you or your organization is interested in advertising or partnering with the Healthcare Facilities Network, including sponsoring content, then please email me using the barcode in the lower right of your screen. From the trades level to the vice president level, from planning, design, construction, project management, compliance, safety, and security, the Healthcare Facilities Network reaches FM people where FM people. I'm glad you brought that up. Thank you. So what happened in 2021 in the Dallas-Fort Worth area relative to polar vortex and snow?
Yeah, it was for us. It was actually in Austin and Waco, Texas.
Austin and Waco.
And, if you look at Texas, Texas is not used to snow. And so when we build hospitals and outpatient centers, we don't build them like we do in Wisconsin. And so we don't have a lot of insulation in the walls, and we don't insulate our pipes. As a matter of fact, if you look at the towns and cities, they don't have a lot of salt trucks and they don't have a lot of snow plows. They're just not expecting it. And so they don't spend for that. And we had a huge polar vortex came in. And there were actually two separate events that combined that ran into each other. And it caused a lot of snow and it caused power outages, and it caused outages with the public water system. Now, we didn't have massive plans for a polar vortex in Texas. All right, we had hurricane plans, we had wind plans, we had flooding plans, and we had some cold weather plans, but not to that extent. But we have really good winter weather plans up in Wisconsin and New York and our other northern states. So it wasn't new to us. We knew what would affect us. And so we had about a 10-day heads up from our meteorological people.
Okay.
And in the presentation, I shared you that first thing that says, hey, we're seeing this kind of brewing.
Yeah.
And so we started to look at our preparedness for it. And there's a lot of things we can do for cold weather in those southern markets. First of all is look at your water piping and systems. Are there water pipes that you can shut off and close to prevent them from freezing? Or can you add auxiliary heat or increase the temperature in those areas so the pipes don't freeze? We started to order a lot of salt. We do our own landscaping, and so we have salt and landscaping trucks there that plow during the winter. So we ordered a lot of salt. We got our crews ready for that. We brought in extra water, and we did that because we just anticipated maybe something's going to happen with utilities. We also checked our boilers. Our boilers are dual fuel, so they can go natural gas or they can go diesel. And we topped off all of our diesel tanks in case we had a natural gas interruption. And so when the weather hit, it hit all the hospitals in a couple of different ways. Roads were closed, so associates couldn't get to work. And then associates had power outages and their kids' schools were closed. And so they had to deal with that. And so we looked at how does this affect our associates and how can we keep them at work? How is this affecting our ability, public transportation, getting supplies in? And so one of the tricks we have is we load up on supplies. So if we think that a storm is coming on Friday, on Monday or Tuesday, we're getting extra supplies in our hospitals so that we can have an interruption in that. And a lot of hospitals only have maybe 2 to 5 days worth of supplies on hand at any time. So you're depending upon those shipments.
I was going to ask you, Scott, how quickly did so you said 10 days out, excuse me, your weather service is telling you, hey, this is coming. When did you pull the trigger and start to act? How many days out were you?
The day we got the notification.
Okay. Wow. Yeah.
Because it's such a significant event.
Yeah.
If we saw a snow event in Wisconsin, and it was interesting, I shared the weather alert to all of my regional directors across the country. And my regional director from Wisconsin, she's a trauma nurse. She's lived up there forever. She says, we're excited. It's going to make the ice thicker for ice fishing, right? So their perspective is way different.
Yeah, yeah.
But we knew in Texas it was much different. And so we got things moving right away. We supply a personal emergency preparedness plan for all of our associates. So we told them to talk through it. Some of our associates that are caring for elderly parents, maybe it's best for them to evacuate. Maybe they should get out of town. And we'll encourage them to do that, based upon their needs as well. And then we made sure we brought staffing in so that we would have them in-house in case the roads failed. And we also worked with the local government to keep them informed and up to date. And then we spoke with the other hospitals in the area as well. And as the storm hit and other hospitals were curtailing services, we were on these conference calls with them saying, we'll take them. Yeah, our dialysis is open. We're prepared. Yeah, we lost public water too, but we've been able to pressurize our system with water tankers. And there's a great story with that too. We have a lot of construction going on in the Austin, Texas area. And when you have a construction site, you have a lot of water tankers. Well, we just called our construction partners and said, start sending those water tankers to our hospitals every couple hours so we can pressurize our systems, flush our toilets, which is a big to do in a hospital. And then use bottled water as potable water to wash hands or to drink or use in cooking. So it came together well, but having that experience up north helped us. We learned some new things too, because as in this past February, when another polar vortex came, it hit the entire country.
Yeah.
And so in Chicago, we're used to cold weather. What we weren't used to is that the grease we use in our automatic doors, it's rated to 0 degrees. And Chicago was experiencing negative 20 degrees. And so our doors were freezing open.
Oof.
And so, we take all these lessons, we learn them. We actually have a polar vortex annex to our emergency operations plan that talks about additional heating, turning off water pipes and doing fire watches if necessary, the type of grease that you're using in your doors, all those things that are part of the plan. And we try to share that as much as possible because it's important for all the hospitals to try to remain open and not just us.
Did your 8 Austin hospitals and the Waco hospitals, did you guys stay open throughout?
We stayed open throughout, full service.
Nice. How do you deal with, not how do you deal with, so you have your associates and they know what their role is and they're committed to their role, but they also have families and they live in those areas. So, like, especially if a hurricane's bearing down or, in Texas, how do you deal with the people component of it? Assuring them, and because I'm sure that's a challenge too. I mean, they're only human. You got a family at home, you want to protect your family, but you got a hospital you got to protect too. How do you deal with that?
Yeah, that's such a great point. And a story from Texas is I remember being on a video call with one of my safety leaders. And they were at home with their family with a flashlight. And then we give them hotspots, and sometimes we'll give them generators and things, but and I'm sitting there going, how dedicated are you?
Yeah.
And so the first thing I always ask is, how are you and how are your family? How's your neighborhood? What's going, how can we help you through this process? And they're so dedicated and committed. And I think we get that dedication and commitment because, first of all, safety and EM people in healthcare, I mean, they have a mindset that is so unique and special. And the second thing is they know we care for them.
Yeah.
They know that we're there for them. And whether it's sending generators and gasoline to them or food, we try not to house pets and people in hospitals during disasters. We try to make sure people have plans so that they can care for themselves. We help them evacuate if we need to. But it's that dedication that really gets us through it, because without those people, we're not going to be able to get through the storm, and we're gonna have to close.
Right. Yeah. You need them. What was your, in the Dallas area in the Austin area back in 2021, were you ever able to assess total damage caused by that incident?
Yeah. With the damage we had, the repairs we had to be made, all the extra support we brought in, it was about $13 million.
Wow.
And so part of our program is I have 2 people dedicated to look at FEMA public assistance and hazard mitigation. So public assistance is a program with FEMA that post-disaster, they help reimburse you for costs incurred, whether it's damage and you have to rebuild, whether it's I brought in a bunch of 2 megawatt generators, or I paid staff overtime to stay inside the hospital. They'll reimburse up to 75% of that.
Wow. And
then the hazard mitigation program is, here's my risks, and based upon the risks, I want to build a flood wall so that I can stay open during a disaster. In the past 5 years, our team's brought in over $100 million worth of approvals from FEMA. And we've also brought in about $8 million in FEMA security grants for our security programs. And I don't pay those 2 people $100 million. And so obviously but they deserve it. Obviously, it's a great program for us.
Yeah.
And so when we do capital planning now, when we're building something in Oklahoma, or we're building something in Texas or Florida or Tennessee, we're looking at the hazards and seeing if we can tap into the hazard mitigation program to help offset that capital cost of that. And capital is very tight in healthcare, as you know.
Yeah.
So having that additional funding can be very frugal in getting your plans completed, as well as making sure you have a facility that can sustain disasters.
Yeah, I was just reading Modern Healthcare this morning, that morning brief, and they were talking about the number of hospitals that have been downgraded financially, and You're exactly right. I mean, capital isn't out there on trees. It's actually kind of scary, but not the point of this topic. I want to ask you that part of the challenge, Scott, relative to the Texas outbreak, and you mentioned it was multiple events. That was what? How long was it? 10 days? What was the duration of that event? Because it didn't quit.
It didn't. The whole thing lasted about 2 weeks. Our focus was about 6 days.
Okay.
And then things started to get restored. Part of our work, I said we work with the federal government. We spend a time with state and local governments as well. So, for example, we needed some liquid oxygen transported to our hospitals up in Austin. And the liquid oxygen supplier is in San Antonio, Texas. And so we called them and they said, we're snowed in.
Mm-hmm.
Can't get out of the parking lot. So we used our state government contacts to get the city of San Antonio to plow out that liquid oxygen center.
Wow.
And then we had state police escort that liquid oxygen tanker up to Austin, Texas.
Wow. Very creative.
Yeah. And it's important to have those relationships, because sometimes when a local government comes in and asks you to do something that isn't right, you have to be able to tell them no. Yeah. Like during one hurricane, landfall was, I think, around 11 a.m. on Monday. The local emergency management came in around 9 o'clock Monday morning and said, we need you to evacuate this facility. And we said, no, we're not going to evacuate it. And here's why we're not going to evacuate it. And we showed them all of our meteorological projections. And I said, so here's my data. Where's your data? And they really didn't have any.
Yeah.
And so they said, okay, you can stay. But sometimes I think hospitals, when a local government comes in and they're telling you to do something that you don't think is right because you have better information, you just go, okay, well, they told us to do it. And what we say is, well, let's sit down and discuss this.
Yeah.
So we both have an understanding of why you want to go in this direction. And it's really worked for us.
Yeah, and I think when the local government comes in a way, it almost gives you cover. Not that you need it, but listen, the authorities are telling us this, so nobody's going to criticize that decision necessarily because you're being told by a entity above. Last question. I know, Scott, we got to go. I could talk to you all day. Scott Cormier from Medxcel, VP of Emergency Management, Environment Care and Safety. When you are managing these events, number one, do you ever wish you could be on scene? You probably can't because you'd be traveling everywhere. And number two, are you up in Indianapolis? How does that work from your end relative to the management of them?
Yeah, listen, I had my fun back in the day, okay. Right? Military and public safety, I had my fun. I have a great trust in my teams. And so I don't mind not being there. Yeah. And we run typically a virtual emergency operations center that is supporting our local incident command teams. So very similar to what FEMA is teaching about ICS EOC interfaces. I did, after Hurricane Michael, I remember I was talking to my regional director, and she's been through a lot of hurricanes, but I got on a call with her one day and she was in a t-shirt and sweatpants, and she had been there about 4 or 5 days. And I said, you know what, time for you to have a break. And I teach my people, we have to be visible leaders. You have to be dressed well. You have to be clean shaven if you're a male. Your hair has to be neat. You have to walk in as a shining sun in the middle of a depressive disaster. Yeah. And so I flew down there and I spent about 4 or 5 days there. And then I brought in another regional director to relieve me. But that's really the sign for me, is that if we can't be this shiny, visible leader that's giving hope to everybody in the middle of this disaster, then you need a break.
Well, that's a great way to end our conversation, Scott. That's a visual. That's a visual for you. Okay, time for me to move. You're right. You're absolutely right. Scott Cormier, thanks for appearing on this episode. A lot of information. Would love to have you back on again too. I mean, just kind of hitting the tip of the iceberg.
Yeah, I appreciate the time and opportunity. Have a wonderful day.
Thank you, Scott. You too. It's Peter Martin from the Healthcare Facilities Network. Thank you for watching.